Are you approaching 65 and feeling a little overwhelmed by Medicare? You're not alone. It's this huge, important program, but let's be honest, it can feel like trying to read a map in a foreign language. What if I told you there are simple secrets to unlock its full potential, saving you money and giving you peace of mind? Stick with me because today we're breaking it all down. Hello everyone and welcome. It's a milestone, turning 65. It's a time for reflection, for looking forward to new adventures. But it also brings up some big questions, especially about healthcare. I remember when my own parents were navigating this. It was confusing and they were worried about making the wrong choice. That's why I'm so passionate about this topic. I want to help you feel confident and empowered as you step into this next chapter. We're going to walk through 10 essential tips to help you get the absolute most out of your Medicare benefits. Think of me as your friendly guide on this journey. First up, and this is the big one. Tip number 1. Mark your calendar for your initial enrollment period. This isn't just a suggestion, it's crucial. Your initial enrollment period, or IEP, is a 7-month window. It starts 3 months before the month you turn 65, includes your birthday month and ends 3 months after. So if your birthday is in July, your window opens in April and closes at the end of October. Why is this so important? Enrolling late can lead to permanent penalties on your premiums, and nobody wants that. It's your golden ticket to get started on the right foot. Set a reminder, tell a friend, do whatever it takes to not miss this window. Now let's talk about the alphabet soup of Medicare. Tip number 2, understand the parts A, B, C, and D. It sounds complicated, but it's simpler than you think. Think of it like building blocks. Part A is your hospital insurance. It covers inpatient hospital stays, skilled nursing facility care, and hospice. For most people who've worked and paid Medicare taxes, Part A is premium-free. Then there's Part B, which is your medical insurance. This covers doctor visits, outpatient care, preventive services, and medical supplies. You will pay a monthly premium for Part B. Together, Part A and Part B are called Original Medicare. But wait, there's more. Part C is Medicare Advantage. These are all-in-one plans offered by private insurance companies that are approved by Medicare. They bundle Part A, Part B, and usually Part D into one package. They often include extra benefits. Original Medicare doesn't cover, like vision, dental, and hearing. Finally, Part D is your prescription drug coverage. This is also offered by private companies and helps cover the cost of your medications. You can get a standalone Part D plan to go with Original Medicare, or it might be included in your Medicare Advantage plan. Understanding these basic parts is the foundation for making smart choices. Okay, let's move on to charge tip number 3. Decide between Original Medicare and Medicare Advantage. This is one of the most significant decisions you'll make. There's no single best choice. It's about what's best for you. With Original Medicare, Parts A and B, you have the freedom to go to any doctor or hospital in the US that accepts Medicare. The downside is that it doesn't cover everything. There are deductibles and co-insurance and no yearly limit on what you might pay out of pocket. On the other hand, Medicare Advantage Part C plans are more like the employer insurance you might be used to. They often have lower upfront costs and include that prescription drug coverage. Plus, they have a yearly out-of-pocket maximum, which provides a great safety net. The trade-off is that you typically need to use doctors and hospitals within the plan's network. So the big question to ask yourself is having a wide choice of doctors more important, or do you prefer the predictability and bundled benefits of an all-in-one plan? This brings me to a very important point. Tip 4. Don't forget Medigap if you choose Original Medicare. If you go with Original Medicare, you'll notice there are gaps in coverage. That's where a Medicare Supplement Insurance Policy, or Medigap, comes in. These are policies sold by private companies that help pay for some of the remaining costs, like your deductibles and co-insurance. It acts as a bridge, filling in those financial gaps. There are several standardized Medigap plans, labeled with letters so you can compare them easily. Just remember, you can't have a Medigap policy and a Medicare Advantage plan at the same time. They serve two different purposes. Let's talk about something we all need, our prescriptions. Tip number 5. Carefully review your Part D prescription. drug plan every year. This is so important. Even if you love your current Part D plan, it can change. The list of drugs it covers, called a formulary, can change. Your costs can change. The annual open enrollment period, which runs from October 15th to December 7th, is your chance to shop around. Use Medicare's official Plan Finder tool. You can input your specific medications and dosages, and it will show you which plans in your area will cover them at the lowest cost. A little bit of homework here can save you hundreds or even thousands of dollars a year. Here's a tip that can save you a lot of money down the road. Tip number 6. Take advantage of preventive services. Medicare isn't just for when you're sick. It's designed to help you stay healthy. It covers a wide range of preventive services, many of them at no cost to you. This includes your Welcome to Medicare visit, annual wellness visits, flu shots, and screenings for things like cancer, diabetes, and heart disease. I met a wonderful woman named Carol, who, thanks to a routine screening covered by Medicare, caught a health issue early. She told me, "It probably saved my life." These services are there for a reason. Use them. It's the best way to be proactive about your health. Now for a tip that might surprise you. Tip number 7. Check if you qualify for financial assistance. Not everyone knows this, but there are programs to help people with limited income and resources pay for their Medicare costs. Programs like the Medicare Savings Programs can help pay your Part B premiums, deductibles, and coinsurance. The Extra Help program can help with your Part D prescription drug costs. Don't assume you won't qualify. The income limits are more generous than you might think. It costs nothing to apply, and getting this help can make a massive difference in your budget and your peace of mind. Let's look ahead. Tip number 8. Plan for long-term care. This is a tough conversation, but it's a necessary one. It's a common misconception that Medicare covers long-term care, like an extended stay in a nursing home or an assisted living facility. For the most part, it does not. Medicare only covers short-term skilled nursing care after a qualifying hospital stay. It's so important to understand this limitation and plan accordingly, whether that means looking into long-term care insurance, savings, or other family resources. Thinking about this now prevents a crisis later. As we get closer to the end, here's my tip number 9. Use the annual open enrollment period wisely. We touched on this for Part D, but it applies to Medicare Advantage plans too. Your health needs can change from year to year. Maybe you have a new diagnosis, or your favorite doctor is no longer in your plan's network. That period from October 15th to December 7th is your annual opportunity to switch from original Medicare to Medicare Advantage, or vice versa. You can also switch from one Advantage plan to another, or from one Part D plan to another. Think of it as your annual healthcare checkup for your insurance plan. Don't just let it auto-renew without a second thought. And finally, my most important piece of advice. Tip 10. Don't be afraid to ask for help. You are not supposed to be a Medicare expert overnight. There are fantastic free resources available to you. You can call 1-800-MEDICARE or visit the official website medicare.gov. Even better, every state has a State Health Insurance Assistance Program, or SHIP. They offer free, unbiased, one-on-one counseling from trained volunteers who can walk you through your specific options. I once spoke with a SHIP counselor, and their only goal was to help people understand their choices. They don't sell anything. They are a pure, trusted source of guidance. Navigating Medicare is a big step, but it doesn't have to be a scary one. By understanding your enrollment periods, the different parts of Medicare, and your plan choices, you can take control of your healthcare future. Remember to review your plans annually and use all those wonderful preventive benefits to stay healthy. Thank you so much for spending this time with me today. I truly hope these tips have made the world of Medicare feel a little less complicated and a lot more manageable. If you found this video helpful, please give it a thumbs up and consider subscribing to the channel for more content to help you live your best, healthiest life, and share it with anyone you know who's approaching this milestone. You could make a real difference for them. Take care, and I'll see you in the next video.